Hey guys, it's Doc Heps here with UroCoach. So have you been having trouble with recurrent urinary tract infections and you're at your wit's end and wondering what to do? Well, check this video out. I'll give you a urologist approach to recurrent UTIs. Hey guys, it's Doc Heps with realurology.com. Make sure you check out the website and see all of our videos. Today we're going to talk about recurrent urinary tract infections. It's a common thing we as urologists see. It happens more commonly in women as opposed to men, and many ladies get really frustrated at the fact that they have to call their primary care or go to an urgent care and get treated regularly. Well, I'm going to give you my approach, how I make sure nothing bad is going on, and then how we treat these infections to help prevent this vicious cycle. So first off, as a urologist, I want to rule out anything bad. The way we do that is usually taking a history, and oftentimes we'll get some imaging. That may include a CT scan or an ultrasound. I want to make sure there's no stone, a lump, bump, mass in the kidney or the bladder. We'll do an exam, reassess the tissues, make sure that the bladder hasn't dropped or fallen. Make sure you're emptying your bladder effectively, because if you're retaining urine, that can be a source of infection. We look for any inflammation in the bladder. We look for any evidence of any polyps or possibly cancer in the bladder, because bacteria can sit on those abnormal areas. Once we make sure there's nothing bad going on, then the next step is, how do we treat this so we can break this vicious cycle? Well, there's a couple of different ways. First, natural ways. We try and optimize the bowels, avoid constipation and diarrhea. We make sure you hydrate, drink lots of fluids to flush the system out. And then there are some supplements such as probiotics. There's something called D-mannose, and there's cranberry supplements that have proanthocyanidins that maybe work against E. coli. Each of these things is probably worthwhile trying before going on to another therapy and seeing if that helps. In terms of medical therapy, how do we prevent this recurrent cycle? Well, oftentimes, and ladies will start them on an estrogen cream in the vaginal tissues or a little tablet that goes in the vagina. Multiple studies have shown that replenishing the estrogen can help prevent and reduce the risk of recurrent urinary tract infection. Another medical way is something called methenamine. It's a pill often taken twice a day. What it does, it goes and concentrates and transforms into a very low dose of formaldehyde in the bladder. Sounds awful, but it's very effective. Side effects are minimal. That formaldehyde helps to prevent the bacteria from growing, and oftentimes we'll treat the infection and then transition to this methenamine to help prevent this recurrent infection from bothering you. Now, antibiotic therapy, it kind of depends on when you're having these urinary tract infections. So a lot of ladies will just have an infection after sexual activity. So sometimes we'll give you something called postcoital prophylaxis. So we'll give you a stash of antibiotics and you'll just take one tablet after sexual activity. Now, alternatively, some ladies just have a UTI maybe 4 times a year, not too often. And so we can start them on something called self-directed therapy, where we give you a couple of slips that have urine culture on them. When you do have symptoms, you leave a sample, bring it into the lab, and we'll also provide you with a stash of a treatment course of antibiotics. You'll call the office and let us know what's going on so we can look out for your urine culture. That puts you in charge. You don't have to call us if it happens on Friday night, Saturday night, or run off to the urgent care. So that's called self-directed therapy. And lastly, some ladies need a low-dose preventative antibiotic on a daily dose. So every day you take a low-dose antibiotic. Oftentimes it's a quarter of the normal daily dose. And we use commonly Bactrim or macrodantin, nitrofurantoin as these prophylaxis doses. And we'll just treat you for about 3 to 6 months and then trial off of these therapies. So I want to reassure you that there are many approaches. You don't have to suffer with these UTIs coming every month, every other month. You should come in, see a urologist, get checked out. There's lots of options to improve your quality of life. Make sure you check us out at realurology.com. We have lots of great videos to teach you more about your body. Thanks for watching.